sad because I've put off filming this video, but that's because I wanted to have a full account of my full experience to share with you. So here I am today sharing how I had a baby post thyroidectomy / thyroid cancer. You may very well hear her rattling around with her little blanket right here in her crib. She's just starting to wake up from a nap, but we'll kind of see how this goes. It took me a little longer to set up than I expected, but we're rolling with the punches here today. This is just what it's like being a parent. But first things first, hello if you are new here. My name is Michelle and I had a thyroidectomy November of 2016.
Confirmed today with the pathology report that I had a 2-centimeter big cancer cell area in my right thyroid. Basically the best thing to do was to remove it like they did. I might have to have treatment later, but that's kind of a little bit down the road once I heal a little bit more. She did start me on levothyroxine, so I'm excited to have an easy transition from low thyroid to no thyroid. We'll get to a little bit more of what I have to do now that the whole thyroid is out, and because it was cancer after all. We'll get to that in a little bit.
And if you're not new here, then welcome back. I'm really appreciative that you've followed along on my journey. I have posted so many thyroid cancer / thyroid journey videos in the past. I have a full playlist, which I will link to up here. If you have a friend that you know that is going through something like this, or family member, feel free to send them that playlist. I have received so many messages about how my videos have helped others feel more comfortable with this process. I am by far not a doctor, just throwing that out there. Not a doctor, not certified in anything except for skincare. So if you like that type of thing, I'll leave a playlist up here that you can check out. But yeah, I've heard that the videos are very helpful, a little bit more of a personal experience type of insight, and that's exactly what I wanted to treat today's video like. So let's backtrack to after the surgery. I had I-131, which is radioactive iodine treatment. And sorry if my voice goes in and out, it's just one of those days that it's not feeling very strong. It happens, it wavers, it comes in and out, especially if I'm a little congested. It's really difficult to sound and like project my voice. Yeah, so bear with me. Anyways, I had the radioactive iodine treatment, and they tell you to not get pregnant. 6 months is mandatory, but then like a full year just to be on the safe side. We hadn't planned on having a baby at that point, so thankfully that wasn't an issue. But in the years following, we kind of started talking about it a little bit more. We got engaged, we got married, and we were just kind of like, hey, I think it's baby time. Like maybe it's time for me to remove my copper IUD that I had as the birth control and like see what happens. But I instantly started to get overcome with all these what ifs, and that is right when I posted the last video, I believe, that I did, maybe like a year and a half ago, about anxiety. And I was having a lot of panic attacks and talking about having a baby and the possibility of what if I can't get pregnant? Well, I do have 2 older children that are now 13 and 10 years old. That was a really long time ago, and that was prior to all of the thyroidness going on, and this would be the first time going through this experience after having it removed. So I was like, well, this organ that controls your metabolism, your sex hormones, all these things in your body that I don't have anymore is now not in my body, and now I don't know, I just was starting to come up with all these what-ifs in my head that were not founded on any scientific justification at all. And the only thing that sort of helped was going to my OB and going to my endocrinologist and asking a ton of questions. Things like, what should I expect after I remove my IUD? Am I gonna still have my regular periods? Am I still gonna be ovulating the same? Because I chart myself in my phone, like I keep a log of everything, even when I had my IUD, just because I like to know what's going on and I like being regular. And the year prior to that, I had been a little irregular. I did talk about that in that previous video. And I was like, am I gonna go back to that again? Is everything gonna be like up in the air? Like, oh, just give it a try. Is there anything I could do to make this be more successful? And pretty much all of them just told me, keep doing what you're doing, stay physically active, you know, fill your body with healthy nutrients, and here's a prescription to go start taking prenatals. So I felt a little bit like, Okay, so they're telling me everything's gonna be fine. It's kind of still a wait and see type of game. And they checked my levels to make sure everything was good at that point, if I remember correctly. Gosh, when you have a baby, I feel like you genuinely like lose brain cells. Like I think they come out of your body with the baby. Pretty sure. That's scientific. You better like look that up. Obviously not. So I'm going to stop myself before I go into any more details and just say if there's something I glaze over or forget because my brain is all over the place, please do not be afraid or shy to either DM me on Instagram or leave a comment down below. I'm more than happy to be an open book and answer your questions. But that being said, I had my IUD taken out May of 2020, towards the end, like right when things were starting to open up again here in Arizona. And then I had a period cycle in June, and then July, nothing really happened. I remember starting to feel a little crampy. I remember being like, oh great, this is the beginning of when your periods get all wonky again, because this is what had happened the year before. And there was one day, I talked about this in my pregnancy announcement, but I had opened up my cabinet and the pregnancy test I had bought from the month previous because I was just excited. I just wanted to have a couple in the house so I could test at my own leisure. It fell out. And I was like, oh, I don't even know that I'm like crazy late, you know, because like I'm charting it, but you just don't know in this uncharted territory. I took it and it was positive. So that's amazing. I immediately made an appointment with my OB, got in to see them to confirm the pregnancy. And then I immediately called my endocrinologist who advised me to, in 6 weeks from that point, because we had just done blood work in June. Yes, I remember that now. We had done blood work in June, and she was like, okay, that was before we knew you were pregnant, so let me do it again in like 6 weeks. So it was towards the end of August, beginning of September, right before our wedding, that I went and did more blood work just to see where my T3, T4, TSH levels were, my blood calcium / ionized calcium levels, and my vitamin D, since those are all prescriptions that I take to keep my body going. I feel like I'm talking really fast. I apologize. I'm like really excited to share this with you finally. Pretty much from that point on, every 6 weeks, I had blood work done for my endocrinologist to look at all of my levels. The only time it ever came back a little bit weird or wonky was in January. I think I had just hit 30, 31 weeks, 32 weeks, somewhere in there, and it started to look a little bit high, just a smidgens. And she was like, okay, we're gonna keep an eye on this. And then we did blood work, I think 2 weeks before my due date, just to see where I was at again. And she said it had gotten even higher. So I was even more hyperthyroid, which even though they wanna keep you a little more hyperthyroid post thyroidectomy, she said it was towards the level of being dangerous, but she didn't want to change it because I was about to go into labor. So she said she would follow up with me after I gave birth to touch base then. So we didn't change my medication right before birth. I didn't feel any heart palpitations. I didn't feel any of that extra excitement in the body. I didn't feel like I was crazy revved up. I wasn't having any bouts of anxiety, ironically. To touch on that, I have followed it through and I've kept attending cognitive behavioral therapy sessions with my counselor. Those have helped me more than medication. I was on medication leading up to getting pregnant, and the moment we found out I started to slowly wean off of the medication. They said I could stay on it. They said it was totally safe, but me in my head, I had more anxiety taking the medication than trying to find a way to be off of it. That was just me, my personal experience. I know several people who have stayed on the medication or started taking different anxiety or depression medications while pregnant or in postpartum. And if that is your journey, I'm okay with that. Do not be afraid to ask for help. Just know it's not going to do anything bad. It was just not something I wanted to personally continue with. And I'm really proud of myself for giving it a try. I told myself if, I was off the medication for a few weeks and I started to feel that unbearable, overwhelming, all-consuming feeling of panic attacks come back, that I would absolutely talk to my psychiatrist about getting back on them. So I wasn't afraid to keep that door open at any point throughout this experience. I know that's not necessarily related to thyroid, but for me, it sort of intertwines, and I wonder if being hyperthyroid fed into the anxiety. But to know that I was hyper towards the end of the pregnancy and I felt pretty level. I mean, there's of course the normal, like, oh, when's this gonna happen? But there's more of excitement. And bless you, baby. But that's excitement. That's very normal. That's okay. Okay, so postpartum, around 6 weeks, we did a full blood workup. I think both at my OB and my endocrinologist. My endo said that my levels were still way too high and she brought me down to the next level of medication. She just checked me again last week and said that they were high still, that they had gone down, but not enough that she wanted to see it go down a little bit more. And she lowered my dose again. Again, I don't know how I feel about this, but I'm just going off of what she's telling me. If I start to feel hypothyroid symptoms, I mean, it's really crazy because a lot of the hypothyroid symptoms like dry skin, brittle hair, nails, lethargy, dry skin, just feeling like bleh, putting on a ton of weight really fast. A lot of that is postpartum too. Like those symptoms are kind of sisters. So definitely keep up with your blood work. Don't just go off of how you're feeling, but at the same time, like, have it come into consideration when you're talking to your doctor. Like, be very honest. Keep notes in your phone about what you're feeling and when you're feeling it. That has been extremely helpful because I can present to her what symptoms I'm having and how often they're happening. So I'm going to stop myself right here because I'm inserting this later on. I forgot to mention it. I want to make sure that I do. On both of my post-baby blood works, the endocrinologist said that my thyroglobulin antibodies, hopefully I'm saying that right, was elevated. She wasn't sure why, and she really was pushing me to do my ultrasound mapping, my lymph node ultrasound mapping, because I had skipped it in 2020 due to COVID and all that, and then I just got lazy with, you know, being pregnant and having a baby and all that. So I did just go through that last week. I have not heard from the doctor just yet about the results. I'm not too stressed about it. She said that it's likely just a spike after having baby, that my body is like thinking it's attacking something, but not sure. I don't know. I'm gonna ask her some more questions at my next appointment, so I'll definitely have to film an update once I have answers from that. But honestly, doing the ultrasound, it's painless, and there was maybe a moment that I started to feel a little anxious when she would stop, you know, and I'm like, oh, excuse you. Where she would stop at an area and I'd be like, okay, get out of your head. You don't know what she's doing. She's probably just measuring things. Everything's going to be fine. And if it's not fine, I can't do anything to change that other than to listen to my doctors, potentially get a second opinion, feel out what the process is going to be like. You don't know. You can't get upset about something that you don't know what's going on yet. So don't get yourself all amped up. Everything is going to be okay. And that is just what I kept reminding myself while going through that. So I just wanted to say that, and now we'll kind of jump back to what I was saying. So hopefully that's not too confusing. I'm also going to insert and say, I really didn't notice that I didn't have a thyroid throughout my pregnancy. Like, it definitely wasn't an ongoing fear every single day, something I was constantly worried about, especially after we got past like the 20-week ultrasound. Like, look at this thing. Look at this baby. Once I knew she was like 20 weeks, for some reason that just brought me so much comfort. I know that if you're too hypo in the first trimester, there is a higher risk of potentially having a miscarriage, but it's not a definite, and you're going to be receiving care probably prior to even getting pregnant or as soon as you find out. So try not to stress yourself out too much is what I'm trying to get at. Try to enjoy the experience, and soon enough you'll be playing with fuzzy baby hair and cute little bows or little like suspenders for boys. And is that fun? Yeah, why is your back wet? Did you just pee pee all over me? Probably. It's okay. It happens. Postpartum wise, symptom wise, again, as I mentioned, it's kind of like very similar to every other postpartum symptom that you could name. I did have a lot of shedding, so much hair loss month 3. It's kind of slowed down going into month 4, but I'll share a little bit about what all that's about in an upcoming video very soon. But yeah, that's what I wanted to say. Try not to stress too much. Everything's gonna be okay. Everything's gonna be okay. See, tell everybody, Amelia, tell everybody, everything's gonna be okay. So you keep a smile on your face, and you keep a positive attitude, and you're just doing the best you can do, right? Yeah. I just thought of something else for postpartum was definitely you're going to be really good about keeping up with your blood work. You just are. You just have to. Because if you do get too hypo during postpartum, if you are exclusively breastfeeding or breastfeeding at all, if you're too low, you may have a dip in your supply. Now that naturally happens at 3 months. Not a dip so much, but your body levels out to produce only what the baby needs. So you might not feel as full and as engorged as normal, and that is totally normal. It doesn't mean you're losing your milk. But that would be a perfect time, yeah, about 3 months. That would be your second follow-up with your endocrinologist or your OB to screen your TSH, T3, T4 levels. Because you want to, if you are producing milk and you want to keep up with that breastfeeding journey, that is super important to keep your levels, if not high, but very normal, not low. But yeah, it's pretty boring. Pretty much the whole gist of it is they check you every 6 weeks and everything is going to be okay. Trust in your body, especially if you've had a pregnancy before. You are more than likely going to be totally fine conceiving again. More than likely, that is what I've been told. That is what I was looking up and reading in different studies and things like that. That was the feedback that I was hearing from a lot of you that were commenting on some of my old videos and found out I was pregnant. But I still wanted to make this to ease your mind that it's going to be okay. And if we need to go into different options after trying for several months, it could be a million different things. There's so much that goes into getting pregnant, but I wanted to ease your mind that more than likely it is not because you had cancer or had radioactive iodine treatment. Again, you want to give yourself that 6 month to a year period after having treatment before conceiving. But other than that, you should be okay and good to go. That is as far as I know. It sounds like she's really starting to wake up now, so I'm gonna go tend to her. Again, if there's anything that I forgot, glazed over, or forgot to finish a sentence and mention, please leave a comment down below or feel free to privately DM me on Instagram. I try to check that pretty regularly, but bear with me. I have a newborn. All right, I'm coming, baby. Thank you so much for being here with me along on this journey. And I want to tell you that you are so incredibly strong. And just by watching this video, you are doing the right thing. You are doing your research. You are hearing other people's experience. You are going to go into your doctor's appointments with all of the questions that you have, and you're going to leave there with some answers to help you feel some more clarity, some more comfort, and just overall like positive vibes. I will leave you here with that. And thank you so much again, and I hope to see you in a video very soon. Bye.